I'm so honored to be joined by my colleagues, Council President Stewart and Councilmember Balcombe. This is our third year recognizing Breast Cancer Awareness Month, and as grim as the statistics can be, this is about raising awareness and about ensuring that we have better outcomes and better survival rates. So I just wanted to share a few statistics because, as a woman of color, we are more impacted by these statistics. The outcomes for women of color in our county and across the nation because of access to care, because of screenings that are done later in life. It certainly impacts our life expectancy. And so this year alone, over 300,000 new cases of invasive breast cancer will be diagnosed. Over 60,000 cases of non-invasive ductal carcinoma in situ cancer will be found in women. Here in Montgomery County, the rate is more than 200 cases per 100,000 residents. And as I mentioned, Black women are 40% more likely to die from breast cancer than our white counterparts. It's due to Black women often being diagnosed at later stages. Only 58% of Black women are diagnosed with cancer in localized areas compared to 68% of white women. These disparities reflect profound inequities and disparities in our system. And as the council's lead for eliminating disparities, I'm proud that our council has stepped up and has funded over $500 million to address programs that fund breast and cervical cancer screenings for women who cannot afford that through their primary care providers, and also ensuring that we are supporting the families of survivors through their care. During my time as a council member in the city of Gaithersburg, I was very proud to do the first breast cancer awareness walk in the most diverse city in the country. And this is also a time for us to focus on ensuring that we are saving lives, screening early, and ensuring that the survival rates become the story that we tell. So before I turn it over to my colleagues, I want everyone to introduce themselves, and then we're going to hear from a few of our special guests.
Good morning, everyone. I'm Wanda Smith. I'm a social worker with the African American Health Program. I'm also a 12-year breast cancer survivor.
Good morning. I'm George McFarland. I am the project director for the African American Health Program funded by Montgomery County government.
Hi, I'm Pat Grant. I'm a past chair of the African American Health Program Executive Committee.
Julia Kepnes. I direct programs at Brehm Foundation to defeat breast cancer.
Oge Okeke. I am the director for cancer prevention and detection at Primary Care Coalition.
Good morning, everyone. I'm Anise Cody. I am the CEO at Primary Care Coalition.
Good morning, everyone. I'm Katie Smith. I'm a member of the Montgomery County Commission on Aging.
Hi, everyone. I'm Jill Walling, and I'm with Hope Connections for Cancer Support.
Thank you. And now we'll turn this over to our council president, Kate Stewart.
Great. Thank you, Councilmember Sayles. Thank you, everyone, for being here. So I speak today as a daughter, as a sister, as a friend, and as a mother, because my mother had breast cancer and passed away way too soon. And this time of year, in October and November, was her favorite time of year. So it's always a time when we do breast cancer awareness that I'm already thinking about her almost every single day. And her birthday was in early November. And so this is really a time of year that I'm remembering her and her life. And sometimes I have to think, like, if she had just gone a little earlier for those screenings, what might have happened. I'm also here as a sister because my sister has had a double mastectomy because of breast cancer. And she is thriving because she got the care that she needed early. And we are so grateful for that because she just became a grandma this year. And so being able to see her grandchildren and thrive is really important. And I'm here as a friend because I've known many women who have gone through this struggle and their families. And want to be supportive of them. And I'm here as a mom because I have 2 children, and every year when I go for my screening, I'm thinking of them first and foremost because I want to be here. Even though they are young adults now, I want to be there for them as they grow up and meet milestones in their lives. And so I want to thank everyone who is up here today, because working to make sure that we spread the information, that we're getting to the early screenings, that we're getting to the care people need, as Councilmember Sayles said, is so important for everyone in our community. And so thank you for being here with us all today. And I'm going to turn it over to my colleague, Councilmember Balcombe, who celebrated an awesome anniversary this year.
Welcome everyone. I'm Marilyn Balcombe, and I have the honor to serve District 2 in the council. And yes, I am a 15-year cancer survivor this year, and so my sister here. And in that 15-year time, there has not been a single day where I didn't know of another woman who was currently going through cancer at that time, including now friends, colleagues, parents of friends. And so it's pervasive, and I'm sure that everyone here, people who are watching, have someone in their lives who've done this. And so this time of year, it's a time of awareness. It's also a time of grief and a time of hope. And so early detection saves lives. It saved my life, I'm convinced. I went every year for my annual mammograms religiously every year. And in 1 year's time, the cancer was found. And so I just urge all of you women to make sure that you get your annual mammograms. And for all the men, make sure that you have these conversations with your wives, your mothers, your daughters, your friends. It's so much progress has been made. Early detection is the key. So I'm here with everyone here to just make sure that we spread that awareness. So and here's to another 15. Thanks.
Thank you, thank you, thank you. This is what we want to hear, more stories of survival. So now I'm going to read the proclamation with Council President Stewart and Council Member Balcombe. Okay. So, whereas breast cancer is the most common cancer among women in the United States, with about 1 in 8 women being diagnosed in their lifetime, and
whereas in 2025, it is projected that approximately 316,950 women and 2,800 men will face the challenge of invasive breast cancer. Tragically, it is anticipated that 42,170 women and 510 men will lose their lives to this disease, and
whereas October is National Breast Cancer Awareness Month, a necessary time to raise awareness about breast cancer and highlight ongoing racial disparities in health outcomes. These disparities are particularly significant for Black women who, despite having a lower incident rate of breast cancer compared to white women, experience a 38% higher mortality rate. While non-white Hispanic white women have traditionally had the highest incident rates, Black women face the most significant mortality, highlighting critical inequities in healthcare access and outcomes. And
whereas Black and Hispanic women often receive diagnosis at later stages, stages 2 through 4, and face significant challenges in accessing care that meets established guidelines for breast cancer treatment. This ongoing issue is influenced by a combination of biological factors, social determinants of health, systemic inequities, and obstacles to timely screening and treatment. And
whereas racial disparities in healthcare persist due to systemic racism, unequal access to care, socioeconomic factors, and variations in healthcare delivery and quality. Addressing these issues requires structural changes in the healthcare system, improved access to equitable care, and targeted public health interventions. And
whereas raising awareness through education and promoting early mammogram screenings is crucial for maximizing effective treatment options and improving survival rates. Early diagnosis and treatment of breast cancer can significantly enhance both outcomes and quality of life. When breast cancer is detected at a localized stage, the 5-year relative survival rate exceeds 99%, empowering individuals to take proactive steps for their health.
now therefore be it resolved that the County Council of Montgomery County, Maryland hereby declares October as Breast Cancer Awareness Month, a crucial time to improve healthcare access and reduce racial disparities. We invite all residents to advocate for treatment access, raise awareness, and support research. We encourage female residents to proactively consult with their physicians and get regularly scheduled mammograms. Presented on this 14th day of October in the year 2025 by Councilmember Lorianne Sayles, Councilmember Marilyn Balcombe, and Council President Kate Stewart. Thank you everyone for joining us.